Hello and welcome to a brief teaching session on the use of coagulation screen blood tests. In this session, we will cover what a coagulation screen test is, indications of when to carry one out, and finally, the use of Wells and Perk scoring systems used within the ED. When is a coagulation screen blood test useful? In unexplained or major hemorrhage, in suspecting bleeding disorders, in major trauma, in monitoring warfarin therapy, in decompensated liver disease, in severe sepsis, and in overdose of some drugs as recommended by ToxBase. Coagulation screen blood test is not useful in the emergency department when taking a routine set of bloods. This is due to the high number of falsely positive results and the high number of falsely negative results, either resulting in unnecessary further investigation or resulting in missing diagnosis. Moving on to D-dimer testing, we normally carry this out when we suspect a DVT or a PE. There are scoring systems such as Wells score and Perk score we use to help determine when to carry this test out and whether the patient needs further investigation. It's important to be aware that the D-dimer can be falsely raised due to the following conditions: infection, recent surgery or trauma, inflammatory conditions, pregnancy and cancer.
A DVT is a blood clot in the deep veins of the leg. A patient may present with pain to the leg, often in the calf or thigh, that is worse on standing and walking. There may be swelling and there may be redness and a warmth to the skin. Usually only one leg is affected. When we suspect a DVT may be present, we can use the Wells score to help us assess the likelihood of a DVT based upon patient risk factors, signs and symptoms. If we suspect another diagnosis, such as cellulitis or a muscle injury, is as likely or more likely, 2 points are taken from the total score. A total score of 0 or less suggests a DVT is unlikely. 1 to 2 there is a moderate risk, and 3 or more suggests a DVT is likely. The D-dimer result and Wells score then allow us to determine whether an ultrasound is necessary. A pulmonary embolism is a blood clot in the arteries of the lung. It is often caused by a clot that comes from the deep veins of the leg. Typically, a patient will present with chest pain that is worse when breathing in, shortness of breath, and hemoptysis. The Perk rule can be used as a guide to exclude a PE. If all 8 criteria are negative and we determine the patient to be unlikely to have a PE, then no further diagnostic tests are required to rule one out. Using the Perk rule can help us to avoid unnecessary investigations. A Wells score for PE, like for DVT, can help us determine the likelihood of a PE and guide which investigations are necessary. A score of 0 to 3 suggests a PE is unlikely, and a score of 4 or more suggests a PE is likely, and therefore a D-dimer is unnecessary and a CTPA should be requested. The Wells score and D-dimer should not be used in pregnant patients. To summarise, we've briefly talked about the indications for sending a clotting sample. A D-dimer blood test can be used in suspected DVTs and PEs. However, a D-dimer level can also be elevated by other conditions such as infection and cancer. The Wells scores and Perk rule can be used to assess the likelihood of DVT and PE and guide investigations. If you are ever in any doubt about ordering a clotting or a D-dimer, please always feel free to ask.